Welcome. If you're watching this video, either yourself or a loved one or a family member is probably suffering with some form of neuropathy, and you're looking to hopefully get some answers to some questions you have about possibly getting better. A good question you should ask is, why should you listen to me? Well, I'm Dr. Adam Schatzko, DC. I'm also board certified in neuropathy from the American College of Physical Medicine. I have 2 neuropathy clinics in the Twin Cities, and I've personally consulted with over 1,000 neuropathy patients in my career. So I come from a point of expertise and a lot of experience and authority. And you can even look on our websites. We have dozens and dozens and dozens of patient testimonials from patients who have gotten really good improvements from their neuropathy, even when they've already tried traditional medical care. So what I want to do in this video is kind of break down 2 really important factors you're going to want to know if you're trying to get better with neuropathy. The first one is, what's the difference between an alternative or a regenerative care program like ours versus if you go into your traditional medical doctor or neurologist? And there's some really important distinctions you need to understand. And then the second thing is going to be, what's the difference between the different types of alternative care clinics around? And there's a big distinction and a big difference between some of the other clinics and what our clinic does. So let's jump into it.
Peripheral neuropathy is a disorder of the peripheral nerves. Peripheral nerves are nerves that extend out from the spinal cord. They travel down the legs to the feet and down the arms to the hands. On the right side of the screen, the top nerve image is a normal nerve with blood vessels feeding the protective coating, the myelin sheath, allowing the proper blood supply, nutrients, and oxygen to the nerve. As the blood vessels start to shrink and vasoconstrict, the blood supply is decreased, and as it gets worse, the nerve will eventually die. One of the most common types of nerve fibers affected by neuropathy are the large nerve fibers. They go from our feet up into the legs, and we have millions of nerve endings in the feet and legs that communicate with our brain for position sense. If I can put on a blindfold and still balance, I know it's not coming from my eyes, it's my feet and legs. When those sensory nerves start dying off, our position sense starts to die off as well. You may have to get up, stop, and gain your balance again before you start moving forward, or you may start taking shorter steps called shuffling, or you'll naturally start looking around you for things to grab onto so you don't fall. Falls are very dangerous. 1 out of every 3 adults over the age of 65 experience a fall each year. 20 to 30% of those who fall suffer moderate to severe injuries, such as bruises, hip fractures, or head traumas. 10% of all falls are fatal. Falls are the leading cause of injury and death among adults over the age of 65. However, less than half of seniors actually talk to their healthcare provider after experiencing a fall. Another type of nerve fiber affected by neuropathy are the small nerve fibers. When these nerve fibers are damaged, we can't feel things that are dangerous to our skin, such as sharp objects or hot surfaces. The reason why you know something sharp or hot is under your foot is because the foot is sending signals to the brain telling us that something is sharp, hot, or just dangerous. What happens if these nerve endings don't work? Injuries, burns, and cuts occur, and the healing of the area is also compromised due to the neuropathy. Damage to the small nerve fibers is responsible for the neuropathy symptoms of numbness, tingling, pinching, sharp, deep stabbing sensations, electric shock sensations, and buzzing. Peripheral neuropathy is the #1 cause of amputations in diabetics, and there are over 80,000 amputations performed per year in the United States. Most people with neuropathy will also experience C fiber damage at some point. C fibers let your brain know the normal temperature of your feet, and when they're damaged, it can feel like burning or freezing sensations. In the conventional medical system, you pretty much have 2 choices for dealing with neuropathy. You can continue to mask with medications and allow the underlying problems to escalate your neuropathy condition, or you can be referred to the specialist, where the difference is that they have advanced ways of testing for neuropathy, but the approach and medications are still the same.
Now, if you're going to go to a traditional clinic or hospital, you're going to speak with usually a medical doctor or a neurologist. They're really good doctors. The only issue is they're a little bit limited to kind of doing what the clinic or the hospital wants them to do. And in most cases, that's going to be drugs and surgery. And when you have neuropathy in the feet, there really are no surgeries for it besides amputations when they cut toes off. And then also, if you're going to take drugs, there's really 2 primary drugs that they're going to give you. It's usually gabapentin or Lyrica. And most of those drugs, and people don't know, they're actually anti-seizure drugs. So they're actually not doing anything to regenerate the nerves in your feet. And there's really no research out there that shows that when you take those drugs, it's actually going to fix or regenerate the problem in your feet. In most of those cases, those patients are going to get worse. So it doesn't do anything to stop the progression of neuropathy getting worse, because neuropathy is a degenerative disease, which means it gets worse the longer you let it sit there. So what the drugs will do is the drugs almost act like painkillers. So they just block your brain from feeling the pain in the feet. What they don't do is they usually don't do anything to improve your sensitivity. They don't help stop that progression. So then usually patients will start with a small dose, and then over time they potentially have to increase that dose because the underlying damage is getting worse. Then you have to take more pills to cover it up. So a lot of patients that come to our clinic, they're not really looking for that. And actually a lot of them already went and did that, and it didn't really do anything for them, or it only helped them a little bit, but their problem kept getting worse and they didn't like where it was going. You can actually go right onto our website. We have a bunch of testimonials, and if you just listen to a bunch of them, a lot of patients will say that they went to their medical doctor, their neurologist, they put them on meds, and then when that didn't work for them, they just said there's really nothing more that you can do. Well, the reality is there actually is a lot of stuff that you can do besides that. It just can't be in a normal clinic or a hospital. Because like we said, they focus on drugs and surgery, and neuropathy, for most cases that we work with, that's not really what's going to get you better. So in our clinic, what we do is we use a bunch of different regenerative therapies, or you could call them alternative therapies, different therapies such as laser therapy, light, electrical stimulation, PEMF machines, vibration therapy. And what these are really trying to do is stimulate your body to respond and heal. And a lot of it, especially with like the light therapy and LED therapy, a lot of it was first started and pioneered by NASA. And they were trying to figure out how to help stimulate more healing for astronauts in outer space. And what they found is that certain therapies can actually stimulate more blood vessels, stimulate more blood flow. They can also help aid in cell regeneration. And this is all there's a lot of research. There's thousands of different articles and references around where you can find research on this. It's not anything new. It's just not something that you're going to find or hear about in a traditional medicine and surgery setting. Also, things that our therapies can do and have been shown in research is they can actually improve the sensitivity. So a lot of patients that get numbness, those drugs tend to do nothing for the numbness. Like we said, they just act like a painkiller. So anything besides, pain, they tend to not do much for. And then also ours can stimulate growth factors, and it's really stimulating your body to try to regenerate or fix the underlying damage as much as possible. So in our office, we're actually getting patients long-term results versus if you take the drugs, you have to take the drug nonstop. You have to take it every single day. And if you ever forget to take it, and it's been a couple of days, all some patients could say, well, wow, my feet feel really bad again. Well, it's not that they got bad again. It's just because you stopped taking the medication. And once it got out of your body, it stopped covering up the symptoms, and you could really feel how bad your feet are. So in our office too, a lot of the therapies we do, research has shown too that it has the potential to stop or really slow down the progression of your neuropathy as it moves forward. So in our clinic, what we're trying to do with this program is actually help patients try to address or fix as much of the root cause as possible, and that leads to more permanent long-term effects so that patients don't have to worry as much about getting stuck with a cane or a walker or really having their life severely limited, because their quality of life can really take a hit if you really lose the ability to walk and be mobile with your feet.
We restore nerve function and health by healing from the inside out. We take a comprehensive approach to peripheral neuropathy and feel strongly that the best outcomes are a result of addressing the body as a whole. A critical and unique part of our plan involves a series of comprehensive treatments that put the body back into an optimal position to heal itself. On the outside of every nerve, there's a spiderweb of blood vessels feeding the protective coating, the myelin sheath, the nutrients and oxygen it needs to stay healthy. As the blood supply is decreased, the nerve starts to die. If left untreated, it will stop working completely. If the top nerve here in this picture is a normal nerve and everything else below it is neuropathy, the goal is simple. We want to get new blood flow to the nerve to help it heal. First, we're going to use a technology called light therapy.
Light therapy is the #1 non-invasive treatment now preferred by therapists for all things having to do with skin and soft tissue. Light therapy devices are FDA cleared to increase circulation and reduce pain. Scientists and clinicians know that light therapy increases local levels of nitric oxide, and that nitric oxide improves memory, behavior, and mood, partly by helping nerve cells talk to each other. Nitric oxide also helps the immune system. It reduces inflammation, increases endurance and strength, as well as increases blood flow at the sites of application. To learn more, let's take a closer look.
A closer look illustrates how the use of light therapy with infrared diodes can help promote the healing process in the body. Pain occurs when oxygen levels at the nerve are too low. Think of how painful your finger becomes if you wrap a rubber band around it. The rubber band cuts off blood flow, thereby depriving nerves and other cells of oxygen. The pain recedes when the rubber band is removed. Tissues that need to heal require oxygen, nutrients, ATP, and growth factors. Nitric oxide provides an environment for enhanced healing. The key to accomplishing this? Better blood flow. The net result of light therapy is a cascade of beneficial chemical reactions throughout damaged nerve cells that stimulate healing. This enhanced, localized blood flow improves tissue oxygenation and therefore plays a role in the following. Improved sensation, which offers better gait and balance when walking. Reduced pain, which can allow for better sleep at night, as well as reduced burning and stinging sensation in the extremities. And finally, increased circulation, which offers the body shorter healing times.
Low-level light therapy helps the body create a protein called VEGF, signaling the angiogenesis process. Here's an example of angiogenesis. The nerve on the top has very few blood vessels. Then after angiogenesis, there's a whole network of blood vessels. This is a real picture of a nerve on the left with no blood vessels, and on the right, a nerve with a network of blood vessels after treatment with a laser and VEGF. The effectiveness of light therapy is supported by thousands of studies. Light therapy reduces pain, improves immune function, accelerates wound healing. Low-level light therapy has been FDA approved for treatment since 2001. In addition, we have to re-educate the nerve about how to work again. Just like if we were to break our arm, we'd have to rehab the muscles after the cast was taken off. We have to rebuild the injured nerve back to normal. We use a technology supported by the Cancer Treatment Centers of America. They use it to rebuild the damaged nerves from chemotherapy. We feel strongly that this is the best technology on the market for re-educating nerves. We use cutting-edge digital electrotherapeutic stimulation to help nerves stop hurting and begin to function properly again. Stimulation is done at home by the patient daily for constant therapy. In 1998, 3 scientists were awarded the Nobel Prize in Physiology or Medicine for their research on nitric oxide and its role in blood vessel health. Nitric oxide is a natural vasodilator. Increased sugars and starches bind to nitric oxide, reducing its efficiency. The typical American diet of high sugar and starches creates decreased blood flow within the microvessels that feed the nerves that are involved with neuropathy. Sugars and starches also create inflammation, which decreases blood flow. Because there are so many factors that contribute to peripheral neuropathy, a comprehensive approach is needed. We'll be addressing the repairing of the blood vessels that supply the nerve with blood, re-educating the nerve, stimulating the nerves and increasing circulation, addressing inflammatory foods, working on the balance portion of your nerves, and addressing the health of the joints in your feet, hands, or both. Most of our patients will pair it up with something they're already doing. You let the technology do all the work.
Were you skeptical before starting the program?
Oh yeah, I walked out of here thinking, what did I just sign up for?
Mm-hmm.
But after probably 2 months, I was completely off the gabapentin.
Excellent. How much would you say you've improved 0 to 100% overall?
I would say about 70.
So you went through our neuropathy program.
Mm-hmm.
What have you noticed change in your feet since then?
Well, a lot of that has greatly improved to the point I would figure somewhere in 80 to 85% range. I've noticed considerably that I'm sleeping better at night, that burning, tingling, throbbing pains have pretty much subsided.
Excellent.
Very infrequently that I'm getting these type of things, and I followed the treatment recommendations as directed.
Treatments?
I've been to a neurologist, and she basically told me that there was nothing they could do.
Okay. So you went through our neuropathy program. What have you noticed change since?
My feet are ticklish.
So you can feel more?
I beg your pardon?
So you can feel more.
I can feel a lot more. I go to a reflexologist, and she said my feet felt totally normal to her.
Excellent.
So they feel good.
So how much do you feel like you've improved overall since starting?
Probably about 70%.
Excellent. Were you skeptical before you came in?
Very. Very.
Okay. And then you came into our clinic. Were you skeptical at all?
Yes, yeah.
Okay.
Even after I started the program, I was skeptical.
Okay. Okay. So how much do you feel like you've improved overall, 0 to 100% since coming in?
At least 70%. It's been a lot.
Got it.
Bit, yeah.
And the sensation in your feet, how's that changed?
Real good. I can feel them. Good now.
Anything else you want to say?
No, just that I was skeptical, and you've got to give it time, and eventually it did help me. So.
Any other doctors you tried before to try to get help?
All they did was put me on gabapentin, and that didn't work.
So it didn't do anything for you?
No. And then I heard your advertisement on TV. No,
so since going through our program, do you have any numbness in your feet?
No.
Do you get any of the pins and needles pain in your feet?
No.
So it's totally resolved?
Mm-hmm.
So from the neuropathy, how much do you feel like you improved overall?
I would say 100%. No.
Anything else?
No, thank you.
You're welcome. What other doctors had you tried or seen before our office?
How many doctors had I seen?
Yeah.
1, 2, and you make 3.
Okay.
So 2 more.
Okay. What'd they say?
They said they couldn't do anything. They couldn't help me.
So you came into our office. You went through our regenerative neuropathy program.
Correct.
What have you noticed change since going through it?
My balance has improved.
Do you have to use that cane anymore?
I haven't used it since I started. I didn't use it all in Florida.
Perfect. So how much do you feel like you've improved overall since starting care?
I would guess over 90%. Well over 90%.
Excellent.
I think it's wonderful coming here. And I really like the fact that we can live out of town and still feel welcome here when I do have an appointment.
Yeah. We like people from all over. So in our clinic, when you come to us, you're going to know you're going to get expertise. Not saying that we can accept every patient or we're going to fix every patient, but we'll do the best we can to try to assess you, see where you're at, give you an honest opinion of if we could help you and what a program would look like for you. So if you'd like to make an appointment, call our office and get set up with a consultation to come in and speak with me or one of our doctors. Or if you'd like, you can keep reading on this page. There's more information down below. I hope you get better. Take care.